The Pacific Islander Diabetes Prevention Program, PI-DPP, is a year-long evidence-based lifestyle change program recognized and supported by the Center for Disease Control and Prevention, the CDC. PI-DPP was formed through a partnership between the Association of Asian Pacific Community Health Organizations and the Pacific Islander Center for Primary Care Excellence, as a project funded by the CDC DP-17-1705 grant to scale the CDC national DPP in underserved areas. Currently, PI-DPP consists of 11 sites throughout the U.S. and U.S.-affiliated Pacific Islands. Aligning with DPP success standards, participants aim for 5% body weight loss, 150 weekly physical activity minutes, and lower HbA1c values. Listen in each week as we highlight PI-DPP sites. Mililani Leui, Program Manager of PI-DPP, sits down with site representatives to hear about their community stories and program impacts. This week, we spoke with Pearl Marumoto of the Belau Wellness Center as part of the Belau Medical Clinic, BMC. Belau Wellness Center is a non-governmental organization based in Koror, Palau, that focuses on the well-being of Palau's residents. In this episode, Mililani and Pearl speak about community-tailored retention strategies in response to the challenges of living on a small island, as well as the importance of lifestyle coaches and participants' health journeys.
My name is Pearl, and I'm from Palau, and my title is Executive Director for the Belau Wellness Center, which is an NGO in Palau that focuses on well-being for citizens and residents in Palau.
My name is Mililani, and I am the Program Manager for the Pacific Islander Diabetes Prevention Program. So the first question is, why is a program like this important for the communities you serve?
Well, the program is very important because it shows us from coming from small islands, we don't have a lot of infrastructure to see what we need to do to improve our health. So such a program like this gives us an opportunity to explore what we have on the island. And the reason why I particularly think that this program is so important, it gives us an opportunity to gather evidence-based information for us to look at what is our health status and who we are, so we can define what are the next steps to change policy to make a better health outcome for our citizens.
Why is it important to tailor the program to your community's specific needs?
It's very important to understand specific needs for our target population is to integrate learning modules from the community, from the grants, from the science, from programmatic areas, from policies, to really understand how people in the community respond to a specific program that gets to be deployed in terms of, particularly in health. If we don't use integrative learning that's targeting specific needs, it's going to be very hard for us to reach a tipping point for any behavioral changes to improve health status for individuals and the community as well as a whole.
Is there any background information you would like to share to reinforce the importance of this program for your community?
Living in a small islands, we're very inundated by challenges. Everything is imported, and living in small islands and going through urbanization processes that we might not understand in a very challenging look at well-being and wellness in the community. We are flexible to bring the program to the location where the people are. We learn where are these people are located so we can look at the environments that they're in. May it be in their community centers or in their offices. As for populations, we need to understand our demographics in terms of like rural versus urban settings, employed and unemployed, educated versus non-educated, to tailor the program to meet their specific needs and then make it enjoyable as part of our retention. It's very challenging to live in an island where everything gets imported. Food market is being dominated by processed foods. The innovation with this program We wanted to introduce the farming to table concept as part of the program, and also understand the food markets in terms of buying power of, for participants to buy processed food versus locally sourced food.
What impact has your site had on the communities you serve?
Well, the impact is huge. It introduces a concept to define services that will promote wellness and well-being. For data, this program was able to collect our data, which was very pivotal point in formulating policies and show to policymakers what can be changed to impact the greater good for Palau. So we use the data to promote and introduce wellness screening to our national health insurance. Community-wide lifestyle changes. The program gave us the opportunity to launch and implement integrative approach using this program, from farming to dancing to music to stress management to whatever approach that the community defines that it's well adapted to them. We were able to use integrative approaches to enhance and increase that well-being of individuals and the community as well. The program also can reinforce established partnerships that we've been working on, but it gave us an opportunity to formalize as an integrative approach to one household or to one individual or to one community. So there's that approach that we look at using that established partnership. We talked about food security at the household level, nutritional intake increase through urban gardening at the individual homes and in the community as a collective group. So it gave us that opportunity through our established partnership to have that dialogue with the state governments, NGOs, grantors, programmatic partners. So it gave us that avenue to have that dialogue, but not just dialogue, actually implement it on the ground. It gives new synergies, these kind of projects.
What are some of your site's challenges and or best practices for recruitment, retention, and general programming?
Challenges would, in terms of recruitment and retention, it's the duration of the program. Sometimes it's very hard to do a year project or a year program. It gets too long. So part of the challenge is for the program to find innovative strategies to make it more interesting. Also, in the small islands, there's so many programs. There's this new program, and we don't come together. So we go to the same target population and the community gets fatigued. Cooking classes, because we don't have chefs that can understand what is a healthy way of cooking. To sit down and have a dialogue with the concept of healthy cooking gets a little challenging. For best practices, we know that if we let the life coaches in the community define activities that they like to do and not have a lot of restrictions, they're more likely to stay together and finish the program. So the flexibility of the program to let the coach and the participant define their own activities makes the class successful and retain attendance and finish the classes. We know because we implement this music, learning how to play instruments like ukulele, harmonica, and dancing are very popular add-ons to the program. That consistency for the life coach to show up also makes this program very successful. So it establishes that trust and they get to know each other in friendly ways that continues after their classes. Part of the best practices is that coaches are very keen on collecting the data, understanding what data means for this program to use to change policy in Palau. One of the best practices are the life coaches who actually believe in the cause and doing this on a voluntary basis. The best practices is having a common goal, understanding where we want to go as a group, and then understanding that data, volunteerism, and wanting to make Palau a better place for the next generation.
What future projects and/or goals does your site have for advancing diabetes prevention and promoting healthy lifestyles?
The next project I would like to use this platform and segue into is getting into the household level and find out our fatalism attitude toward diabetes. Looking at the national data and our data from this program, it's evident that we have high diabetes rates. I want to understand how, as Palauans, look at diabetes through our fatalism lens. Because I hear in our own cultural context that it's okay, my parents had diabetes and they died of diabetes. I am going to be having diabetes, so I'll just, keep doing what I'm doing. So I want to go in and see what is our fatalism attraction to diabetes. We can really understand what kind of a healthcare system we're building toward the future.
We thank Pearl from Belau Medical Center for speaking with us during this week's segment. Please stay tuned for our next site highlight.